This issue that pulmonologists are tasked with in the wake of COVID-19 is being able to differentiate asthma exacerbation from a potential COVID-19 presentation, right? You've got to be able to sift through that. You've got to be able to use labs, use the clinical history to be able to have an understanding of what is SARS-CoV-2 infection and potentially COVID-19, and what is severe asthma and an asthma exacerbation. That's one. Two is you have to still be able to provide care for your patients that have chronic asthma that are afraid to come to the doctor because they're afraid of being exposed to SARS-CoV-2. So you're going to have to offer telemetry visits. You're going to have to become tech savvy if that's not your forte as a more experienced physician. You got to be able to offer that to patients. Three, you want to make sure that patients are picking up their medicine and that they are taking their medicine as they're supposed to. So you might have to call the pharmacy and just make certain that the patient is. Four, you got to follow your asthma patients and figure out who needs what and how they're doing. You know who your severe asthmatics are. So you may want to give them a call and say, hey, listen, Candy, like you're in my office every month for prednisone. You haven't been here for 7 months. What's going on? How are you doing? Right? So you have to be able to have this understanding of what's going on in your asthma patient's life. So that way your patient doesn't develop severe asthma or worsening asthma and end up in the hospital and possibly on the ventilator, all because their asthma was mismanaged because of their fear of presenting to healthcare.